Welcome to Skin Deep. I'm Dr. Anna Chacon, and today we have a very special guest joining us. Get ready for some expert insights you won't want to miss. Let's dive right in.
Good. Nice to meet you.
Nice to
Thanks for
meet
coming
you.
on my show. So this is very low key. It's my podcast. This is the first day we're doing it. We have a lot of guests today. I read a little bit about you, and so I had a couple questions, but it's pretty much free flowing. And so I wanted to talk a little bit about, how Lana got to where she is today. Where are you from? What's your upbringing?
Yeah. Awesome. By the way, that's a beautiful background. Is that real?
Oh no, it's not. Let me
Oh.
just show you where I'm at. I'm in Miami, Florida.
Oh, you're because I'm like,
So, yeah,
that it looks so real though.
yeah, no, I'm
Oh my
here.
goodness.
See the palm trees in the back and a couple of diplomas, and my grandma put this garland.
Yes.
Just kind of, but I like this one because I actually work part-time in Alaska in a place that looks like this.
Yes.
And patients really like it. It's
Awesome.
almost like, you're in your living room in a cabin. You don't feel cold, even though it's freezing outside.
Oh, I love it. I love it.
Yeah. Yeah.
Tell me
Is
something.
it
First of all,
is
I
it
love the name.
you real?
Huh?
Is that a real background? The one behind you?
Background.
Okay.
Yes, I'm in my office, in my home office.
Okay. Cool.
Yes.
Excellent.
Yes.
Yeah.
I love Anna, maybe because it sounds very similar to Lana.
Oh yeah.
But have you used the CO2 lift?
No, I have not. I do get a lot of, I'm probably the simplest dermatologist, I do not use a lot of skincare things. I use a lot of stuff, thank you so much, thanks, that is in my bathroom. I have a bathroom full of stuff. I'm also an influencer, and so I get a lot of brands sending me things. So many, actually, that I don't think it's possible to try all of them, but I'm definitely open to using it. Yeah, I've gotten to wear very little things on my face throughout the years. I use moisturizer at night, sunscreen in the morning, wash my face twice a day, and that's about it. And some makeup on occasion. Yeah. Mm-hmm.
I'm very similar to you. I'm a very simple person, and we get a lot of skincare. I'm always afraid because my skin is so sensitive. So I think when we get into the discussion, you'll see that CO2 Lift. I mean, we have a skincare line like Lumis has one, but the CO2 Carboxy, it was funny. I just saw one of the doctors. A lot more plastic surgeons are using us now, although we started in dermatology, just because after we did our wound healing study, we can close a non-healing diabetic ulcer in 8 days. That appeals to surgeons because they have the complications with healing after facelift. So when we started it almost like a rescue kit, even with injectables, because it reverses or helps with vascular occlusions. Because if you think about a hyperbaric oxygen chamber, that's very similar to what CO2 Lift does, but you can do it at home. So we're getting a lot of large, big names in plastic surgeon who are just like, in fact, one of my favorites, I just saw he posted on it. I'm like, oh my God, he's using it. So
which plastic surgeon?
This is, Eve's Lift. That's his whole thing. Is it called Eve's Lift? He's in Miami. What is his name? I love it. Let me tell you, I in fact, I know so many of the great plastic surgeons. I'm like, who am I going to go to when I'm 60?
Okay. Oh, I see. Dr. Ali. Okay.
Yes.
Plastic Surgery Institute. Okay, interesting.
And if you look at, he posted it, and I just saw it last night. You'll see it come up. It's this 1, 2, 3, 4, 5, 6. So 1, 2, 3, 4, 5, 6 to the right. You'll see the CO2 Lift, and he calls the CO2 Lift mask. He started using it after his facelifts, but a lot of like they're using it on breasts, they're using it on body. Surgeons have really helped us just because they use such volume, too.
Yeah.
So it's always just good to see when people who people who I like, not idolize, but I was like, if I ever could afford Steve Cohen in San Diego, he charges $100,000 a facelift. He's been using it for right after. So, and they reach out to us. I mean, you have Cheryl Aston in New York, like he's like the godfather of what you call that one? deep plane facelifts. When he came over to me and he says, Lana, I want this in my office. Or this other, when I was at CSAP's, a dermatologist in Vancouver, he says, I've been in this business 30 years. Two things have impressed me in my life. When Jean Carruthers came over and said, why don't you start injecting poison in people's face? And
Yeah.
when I heard about CO2 Lift, in fact, I've never done this. And he showed me his text. I asked my office manager, why don't we have this in our office? So because I need if you can send me your address, I'll give some for you to try. I'll ask our rep, Dasha, who's manages this area, to come over and do a demo, but also for you to try it. It's amazing. So that's all I'll say.
Great. Yeah, I'll definitely send it. A lot of things I do is, so I was going to ask you, how important is it to have like, a medical doctor backing, or trying your product? We, oftentimes if we talk about something, patients will ask us, well, what do I do for skincare? And companies that are really, really large, let's say Neutrogena or Eucerin, they give us samples all the time, and people think it's they like receiving it, but they actually think it's part of their treatment, so they go out and purchase it after, And of course, it's much harder to do that with pharmaceuticals, so I don't give samples of pharmaceuticals. You have to sign your medical license, attach it to it. Sometimes the state licensing boards want to know that, what stuff you're getting from pharmaceuticals. So it's much easier with over-the-counter things.
This is a cosmeceutical, so you won't have run into that at all.
Yeah. As opposed to the pharma products, because, sometimes patients don't realize getting samples of a prescription as a physician is actually kind of hard. It's got to be tied to your license, and it goes, even some state boards want to know that, well, how much money in samples did this doctor get, and things like that. And you don't have to worry about that, to my knowledge, about over-the-counter items.
Yeah, definitely.
Yeah.
Definitely.
Yeah.
I mean, I have a lot of derm friends who I recently, within the last less than 4 years, I got vitiligo. So I'm always depending on them to send me some, what's the word? Oh my God, why did it skip me? What is the thing? Not, I won't say, what is it called? What is the thing? What is it for vitiligo? It's a JAK inhibitor.
Oh, okay, Opzelura.
So
yeah.
My derm friends send me in mail Opzelura just because it's so expensive. So I only stayed on my hands.
There's a cheaper version, by the way. Yeah, there's different versions you can get that are a lot cheaper. Yeah.
Do you know Rania Wiles?
Do I know who?
Rania Wiles.
No.
So she's at the Mayo Clinic. She does a lot of speaking. She actually put a prescription for me at a compounding pharmacy for she said it's similar to Opzelura. So I've been using that along with the samples. I don't know, but if you know any cheaper version, I'm always open.
Yes, there are. I've even had patients from Mexico drive to the United States to buy this. Yeah, they will literally do that, because in other countries it's even harder to get these brands. The other thing is I'm involved in a clinical trial. I do clinical trials as a principal investigator, and one of our big trials is vitiligo. And there's certain types of vitiligo that are harder to heal than others, like depending where you have it, it's harder to heal. And in fact, there's another thing I do that is unique with vitiligo. It is complete depigmentation. And I learned that because I like to travel and learn. I just like learning. I'm very much a nerd. And so I traveled to Kuwait, and in certain countries, patients with these skin conditions are shunned from society. So they completely depigment a lot of the patients. And I do that here. There's not many dermatologists that do that. Every candidate is different. Every patient is different, but I do that here. And that's, through compounding as well. We mix different percentages, and it requires close follow-up and things like that. And of course, not everybody's a candidate, but we do that as well.
Yeah. So Pearl Grimes?
Yeah, she's in Los Angeles. She's a big, vitiligo expert. Mm-hmm.
A client of ours from way back, one of the earlier adopters of the CO2 Lift. And so we became friends. And when I saw her after COVID, it was right then, and I didn't know what it was. It was on my neck. And she said, Lana, come. And I went to Beverly Hills. And let me tell you, all of when she treated me with some different steroids and stuff, I repigmented on I repigmented my vulva, everything. Then my hands started. It's just hard to go to Pearl because the first time I went, she sent me back my check. The second time she sent me back my check. And I'm like, Pearl, you buy product for me. We're in business. You can take the money. And so it made me feel uncomfortable to just keep going to her. So I actually just recently went to, because it just started back again, because it stopped. It just started, and I went to, I forget his name. Where is a derm? He's medical derm in Pembroke Pines. So I just went, he put me on another round of steroids, and I have the light therapy. But anyway, yes. But if I ever got in my face, I'm telling you, Anna, I would definitely consider taking the pigment out, because it's just stayed in my hands and it's on my arms. Yeah.
Yeah. So that is, yeah, there's different subtypes, and that's one of the hardest ones to treat for sure.
Yeah.
Where are you from? Did you tell me?
Jamaica.
Okay.
Yeah. So I was born in DC when my parents were medical. My mother was in dental school, but I went back to Jamaica when I was 5, and I grew up in Jamaica.
Okay, cool. Yeah, there's a lot. And you live here in South Florida?
I live in Weston, and office is in Fort Lauderdale.
Okay, cool. I actually used to work in Weston for 3 years. I worked at the Cleveland Clinic there.
Okay, yes. Okay.
Yeah. Weston has really exploded. It's also a really great neighborhood. It's like great to raise families. They have good schools. It's great. Definitely a little calmer. The restaurants I wasn't crazy about. It was actually hard to find a good restaurant in Weston, I thought. But yeah, it's definitely up and coming, and that area is always growing.
Yeah.
And then tell me how you came up with the name, the CO2 carboxy.
The reason why is because of the action of, well, it is carboxytherapy, and I figured CO2 meaning carbon dioxide, and it lifts the skin. I'm like, what lifts? I mean, it's hard to, I remember when we came up with the name, some of the derms, because we started with just, as I said, dermatologists, like, people are going to confuse you with CO2 laser. And that's exactly what happened. Because when the people say CO2, they automatically think CO2 laser. And now, because of the imaging of the gel, it's really taken on. So we came up with the name because we wanted something to connect with carbon dioxide. So it's CO2. And then it lifts the skin almost like a facelift. And I tell you, and I have derms now who met me 8 years ago when we started, and now they're like, Lana, I'm getting an account because your skin, you look better now. I'm 53, going to be 54 next month, than when I was in my 40s. And I can't use energy on my skin. So I do the CO2 lift once a week now, but you'll see. I cannot wait for you to try it. And then, we have which is my passion, we have the CO2 Lift V for vulvovaginal. That to me is what's a game changer for, not only for when you think of sexuality, and because that's such a huge topic now, menopause, perimenopause, but we've had some gynecologists in Dallas who have actually helped women get pregnant. Now, obviously, how do you get a clinical study with that? But who have tried to put the embryo in, they've lost the baby, they can't carry a baby past 4 months, who've gotten pregnant and carry the baby full term. So we have some really great studies on what the CO2 Lift V does for women. It just changes a game in terms of intimacy. So that's one of that came about again because of my own needs. I could see the difference in the quality of sex when I was around 48 years old, 47, 48. And when we did the wound healing study, that made me think we can blood flow. The problem with us, we need blood flow to our clitoris, and blood flow slows down at 25. If I can heal a non-healing wound in 8 days, what can I do for my clitoris? So we did, and then the vaginal tissue is like under the eyes, is thin, and it gets thinner. So sensitivity, you lose sensitivity, you get drier, and it's not as juicy. Well, one of our medical directors is a gynecologist, and we said, what do you think about using the CO2 lift in there? We did a double-blind study, Anna, and the results. First of all, the women that I know we're going into the podcast. I don't know if you want to talk about that, but anyway, we have the CO2 lift.
Yes. Mm-hmm. Yes.
We have thousands of women as breast cancer survivors, women my age, young women in their 20s who have lichen sclerosis.
Yeah.
But lichen sclerosis in 10 days are getting relief, can have sex, enjoy it, can pee without it burning. I mean, it's amazing. So those are just some of the things.
Cool. Yeah, I know it's an area that's commonly neglected and that it just shrivels up. The other thing I noticed with weight loss, it'll shrivel up. Now that there's all these weight loss medications out there, actually I'm on one. I lost a few pounds, well, a lot of pounds on one. I was a little bit chubby and now I'm normal. But I even feel like, I kind of was like, it feels like my face needs a little bit of a lift, but it's the rest of your body too. And this area is being, it kind of is being neglected. And, they have these lasers out there. They have vaginoplasty and those surgeries who wants to have a surgery. It's just much easier to do something non-invasive first, Yeah.
Oh, yeah. And I did vaginoplasty just in July. And
you did?
I did. And I talked about it on
How was it?
Oh my God. I would recommend any woman over 50 to get it. Let me tell you why. So there's 3 components. You have the tissue, which CO2 Lift is. My tissue is like a 21-year-old, right? I can lubricate for 3 hours of sex, like sustained lubrication. That's one. Tissue is one thing. Blood flows to the clitoris. You need it engorged. You need it fat. You need it juicy. And of course, the outside. But the muscle is another thing. Women say, oh, I get tighter on CO2 Lift. Yes, because the tissue is thicker. It feels like a marshmallow when inside. But the muscle and the angle, as you get older, that angle, which is like this, the penis goes in, hits the clitoral root, you get high off of that. Once you get older, it falls just like everything else. It's not hitting the clitoral root. When I did the vaginoplasty, and I flew out to Michael Reed in Sacramento, change the angle, tighten it. Oh my gosh. Anna, it's like a glove. It's like my vagina hugs his penis like it was meant to be. It's that sensation with the juice, with the sense. Listen to me.
Oh my God.
I'm like, yes, that's it.
We flew from South Florida to Sacramento. Why that surgeon and what? I just like to think how I personally like to know how patients pick these people.
I know a lot of these cosmetics because I'm in the field.
Okay. Yeah.
I mean, that is such I wouldn't go to a plastic surgeon for that. That's because a labiaplasty is different. Vaginoplasty, you really have to know the anatomy of the vagina. And there are very few cosmetic gynecologists that are, I feel, outstanding. This particular one, Michael Reed, he's done thousands and thousands. He has never had a mix-up. Can you imagine that area messing up? Oh gosh, no. And he understands pleasure. So he's not only doing the tightening of the thing, but he understands a woman's pleasure. So the clitoris. So even how he fixed, if you look at my vulva now, it looks like I was in my 20s. I didn't think it was a big deal because the skin quality was good because of CO2 lift, but the angling has changed. It just tucked in. And I didn't do a labiaplasty. I did a clitoral hood reduction, vaginoplasty. And it was amazing results. That's why I flowed to him. I didn't want any mix-ups, and I wanted something that I knew I would get the result, and that's why. I mean, I know Red Allen saw it too. He's actually very good. It's just that Red is more known for labiaplasties, and so I want vaginoplasties, which are not as common.
Okay, cool. Yeah, I actually thought you were talking about a labiaplasty, so that's not what you had, or okay.
No, so they had a it's like he did the perineum, he did the perineum, he did the vagina walls, he did the angle, he built up the angle. So I told my husband is riding around in like a Rolls Royce right now.
Oh my gosh. Oh my gosh. Okay. No, I don't think I ever heard of that surgery. That'll be something that I need to look into.
because they don't talk about it, because women are often thinking about just the cosmetic, the look.
Right.
No, I want functionality. I mean, I always say this gets your partner, that keeps your partner. And it's not just about him, it's about your own pleasure. So the vaginoplasty is all about you, getting you to feel that with the maturity that you have as a woman now, confidence, because it gets you back to in your 20s, like you're a virgin, but now you have all of the know-how, think of merging that together. It's very explosive.
I understand. Cool. And then, so the CO2 carboxy, is this for your face or for the vaginal area?
We have two. So we have the CO2 Lift Carboxy, which is a CO2 Lift Pro. If you go to lumis.com, you'll see it. In lumis.com, you'll see the Pro. That's what they use on the face, the neck, the hands, the breasts, the belly, the flank. Use that on the body. The CO2 Lift V, the difference with the V and the Pro is the pH. So we're addressing pH, ideal pH for the vagina, 4 to 4.5. And then it's going inside, and a little slightly different formulation that helps with inflammatory issues that women commonly get. So women who are used to getting BV, a lot of infection, and a lot happens to a lot of women as we get older, it rebalances it. They're not getting the yeast infections. They're not getting the BV. It smells fresh because it's keeping it in balance. And it's a treatment that once you finish a series, then you just maintain it with a monthly. So 10 treatments would be similar to doing 4 sessions of maybe some type of InMode device, or, any type of laser or RF for vulva vagina.
Okay, interesting. And you actually have some providers affiliated, and actually it looks like it's almost all over the United States.
Oh, yeah.
Okay, you have dermatologists as well, gynecologists too, and plastic surgeons. Would you say those 3 groups are?
Yes, injectors, a lot of injectors right now, because like even, Lee Walker? So he's big on he's a master injector person. He's from the UK, but he does a lot of touring in the States. But they've used us as their rescue kit, because when you get a vascular occlusion, once you dissolve the filler, they usually send them to hyperbaric, right? Well, if you just we recommend 6 CO2 lifts, which can be done twice a day. By the weekend, you're back to normal. I mean, we have some impressive pictures on that. Vascular occlusion on the penis. You're talking about Friday, and by Sunday it's gone, because a lot of men are getting fillers in their penis. So that's another one. Yeah. They've been using it. Can you imagine? No, the vascular occlusion there, I would be scared. Well, they use it. And again, it's hard to do a clinical on it because no one is planning a vascular occlusion. But once we have one, they're using it as a rescue kit, but it's great for even after filler, post-injectable, because it sets the stage, and we'll, I kind of thought of it when I was looking at some of the questions that you had, how CO2 Lift really is different from really anything, even with exosomes on the market, a lot of biostimulators and bioregenerators. CO2 Lift is like the basis for anything like that. It's making it better because of what it's actually doing for the body.
Okay. Excellent. And then, what other things? How did you pick? Where is it manufactured? And what were the steps you took to start a skincare line? Because it seems like a lot of people have a skincare line. I'm sure it requires a lot of investment, time, but how much time did it take? What were the steps you took?
I do 5 to 8 podcasts a month. I really don't even need to prepare. I'm kind of like, I can do this in my sleep. You can ask me any question, I'm going to give my best answer.
Okay. Yes. So tell me kind of what steps you took to start the skincare line, how you found a manufacturer or cosmetic chemist or things like that. Yeah.
Okay. You want me to answer that now, or you want to?
No. Yeah. You can answer.
Okay. So no, basically we looked at the technology. I've always been in business. I've always liked things before people have it. We started, we're very innovative, my husband and I. And, I started my business, the first business I had, I was 14 years old. I'm Jamaican. I'm very, Jamaicans, like they have 10, 12 businesses. Well, I started at 14 my first, and then even though my educational background is in accounting and finance, which I worked with KPMG for a few years, I always loved healthcare and beauty and wanted things ahead of time. So when we started our weight loss clinics, we started with HCG before anyone in Florida. We were the first in the tri-state to have that. So when we got into the skincare, I'm just looking for what is innovative, what is regenerative, what is different from anything that's out there. Because I had a spa myself on La Sola. So I was like, what can I use there that's not typical to what Chino was using down the street, Chino Bay?
Yeah, Chino Bay Aguilera.
So I looked at, interview people on what do they use on their skin. And I heard one person who had good skin and carboxytherapy, and I had never heard about it. So that caught my attention. Like, okay, that's nobody's talking about that here. Just looking into it, though, the only carboxytherapy that was known and where she did it was in Europe, when it's with injectable carboxytherapy. So, Japan is really known for a lot of technology, and I have friends there. And long story short, they told me about some scientists who just developed a gel delivery system. So we met with them, and now we have the exclusive license to that technology. So it's the first gel, and we invested heavily in clinical studies. So you talk about the steps. We wanted to go with premier dermatologists. I always like from the top down. And I wanted to have the people who, I know they're not using this terminology anymore, key opinion leaders, but I wanted to have the leaders.
KOL. Yeah, KOL.
They're not using that anymore, the term. I wanted leaders in the field, people who were innovative, people who taught their peers. And so before we even launched, we gave some to some premier derms who I knew before from my weight loss business. And they used it for about 6 months, and they all said, Lana, this is a game changer. We launched it at Michael Gold's meeting in Scale. And
how was that?
Oh, well, that was great. We go every year, but that was back in 2016. And that was at the time at Michael's meeting, there was like 500 people. And when we used a model and did the before and after. So we did it. Wendy Roberts spoke about it. Then they sits on your face for 45 minutes. Brian Weisman then talked about injectables, did some, and came back to us. When you saw it after, Anna, we opened 300 accounts that day. People were like, this is crazy. This is no fillers in her face. Like, how in the world?
Wow.
And that's what kind of got started. And then we've invested in quite a bit of studies. We've done it post-procedure. We've done it right now. Now that we're in the surgical space, we're doing with, body contouring, facelifts, flaps. We just did one with the Mayo Clinic on post CO2 laser, but not only in terms of the fast healing of it, because we are the fastest way to heal the skin, but what is it actually doing on top of that? They did biopsies, punch biopsies on the side with a CO2 lift. And what you're seeing is a reduction in senescence. Increase in telomeres from using the CO2 lift. So really a production of collagen type 1 and 3. Really impressive stuff. So we have invested heavily in clinicals, and we just did a perfusion study. We did another venous ulcer study on 40 patients, and those were just incredible results. Nothing healed them. To have CO2 lift in a month, to have some closed completely, and some, that's a big deal. So we've done 3 clinicals on the vulvovaginal, 2 have been published, and also including stress incontinence. So we have quite a bit of, I think when you talk about the steps, is initially establishing the efficacy, I think is so important. And that's what we did. And then we had a lot of big celebrities who use the product, and they tagged us, celebrities like Chrissy Teigen, Bella Hadid.
Wow.
Even recently, I know she's not a big Erin Andrews, but that was a big one because she said this, she had it on her face while she was driving. We've had Angela Bassett. We've had quite a bit of, who post and tag us on the Kardashians. Courtney, I know they're one of the top accounts that we have in Beverly Hills, treats the Kardashians. Kim uses it on her patients. Do you know one? So she has a couple doctors that she goes to, but the one who Charlena Hassani is her individual who goes to her house and treats her. And it's sealed to lift. We've had pictures just with her having it, and then they repost it. So we have people, just recently, Tess Mauricio treats a lot of celebrities. So Paula Abdul uses, Cardi B just got the V from, we have quite a bit of celebrities that we don't pay, and they have pictures with it, tag us or share it or something like that.
Okay, cool. Wow, that's excellent. And are they all made in the USA?
No, the CO2 lift is made in Japan.
Oh, okay, cool.
Manufactured in Japan.
All the products or just some of them?
This is CO2 lift line. So the CO2 lift line, which is the line that we're talking about specifically, because we're the only ones with gel carboxy in the world. So it's the CO2 Lift Pro, which is the version that doctors have. And then it's a little different, the CO2 Lift that people buy through our website. It's a slightly different formulation, not as, I don't like to say not as good, but not as strong as derms or providers carry. Then we have the CO2 Lift V, which is the vulvovaginal gel. And the CO2 Lift Pro is also used on the penis, by the way, because it's helping men. It's improving shim score because, again, it's blood flow to the penis. Then we have the CO2 Lift Mousse, carboxy mousse, which is really taken off. I mean, we have people like Savannah Boda, who is surprising. She's an esthetician, has a lot of influence. When Savannah Boda posted on this, and she had told us, she was always one of our better clients. I mean, she hated the look of the mousse. She said, "I hate this. I will never promote this. It's just ugly. The packaging." I'm like, okay, whatever. I love it. Her guy had acne and used Skin Better and never got worse. So they tried the CO2 Lift Mousse, got rid of his acne, and Savannah was like, "This is crazy." Then tried other patients, the acne. She talked about it, and from then, I mean, she sells, last month, Savannah Boda, just to kind of give you an idea, she sold maybe 2,000 units. We have a waiting list right now because we didn't prepare for the type of, we have a waiting list right now of 5,000 mousse, just waiting, because we know, but all of those products are manufactured in Japan.
Okay, cool. Excellent. So are there 3 products, the Pro, the Lift, and the Mousse?
And the V.
Okay, and the V.
Mm-hmm.
Okay, I see. Okay, so they're all CO2 Lift.
Yes, that's the brand name for the carboxy. The Defend and the Glow, which are also nice products. I don't really talk through them on the show because other people have them. The Defend is great. We source, and the Glow, we source our oils in Europe. But I don't talk about those because what we're talking about is carboxy. That's the education that needs to go out. That's what's different. No one else has it. You know, it's been described as sun and water for the skin, whereas exosomes, PRP are all like, what you call them, fertilizers. You can't do without the sun and the water.
Okay, excellent. And then I think, what are you planning on creating more products? Where do you think there's room for growth in the CO2 Lift line or your line in general?
I think that certainly the benefit of carboxy, I mean, L'Oreal, there was an article in Allure maybe a year and a half ago where Allure magazine talked about how L'Oreal understands the benefit of CO2 gas to products because it actually penetrates further. And so, I mean, that's something that we would consider. Right now, I think our focus is on education. We're just still scratching the surface in terms of information on CO2 lift, what carboxy can do for the skin. So our really goals for the next 5 years is just more market penetration. We are worldwide. It's really taking off in Saudi Arabia and Dubai, especially the V. We just launched in India, and that will be in other words, we're international, and that's just kind of taking off. So I feel like our focus, and as the CEO of the company, my focus is really on education and market penetration.
Okay, cool. Excellent. Well, thank you so much. And any other questions or last minute thoughts?
Well, question. So this was a podcast.
Yeah. Yeah, it's over. No, I'm kidding.
Oh, I saw it. Well, I think, okay, I think then the last minute thoughts, I want to say that, where we kind of stand out as different in the sea of skincare, there's, as you said, there's so many products, but I think what makes us different is that we are, again, just essentials. We're the essentials in skincare. Why I say that? Because when you use it, your moisturizer will work better. As you, as a dermatologist, the skin gets thinner. So everything kind of stays to the surface. We thicken skin. So if you use a CO2 lift, you're going to get better results from your skincare. One of the two things that I think are outstanding about CO2 lift, in one of our studies that we talked about, what is it doing as a standalone? Hydration is so important for youthful glow. And CO2 lift increases hydration 117% after one application.
Wow.
So think about that. I mean, and I always use the example or analogy of a raisin and a grape. The grape, what's the difference? It's the water content. If you took the raisin is just a shriveled up grape. And that's what happens to all of us. We're born this beautiful grape, and then we turn into this raisin. So what we need to do? We need to keep our skin hydrated, and moisturizer is necessarily doing it's keeping it in. CO2 lift is effective. Elasticity, that bounce back, that baby's bottom look to your skin. CO2 lift does that in 6 applications, 26% increase in elasticity. Nothing does it. Even when you do RF, what is happening? You have to wait, and you're not getting those type of, you wait 6 months to get those type of skin modulation. So to get that in a month with 6 applications of a gel that's very pleasant, it's kind of too simple. Those are some of the factors. And luminosity and radiance. So we have double-digit improvements in the skin with only 6 applications of the CO2 lift. So sorry, that's a long wind up, but I think of CO2 lift as essential. If you mentioned at the outset that you're simple to skincare as a dermatologist. I feel that I'm a very simple. Growing up in Jamaica, I didn't even wear makeup. I think that CO2 lift should be a part of everyone's skincare routine. If they want to look young for a very long time, this is something that will do it, because everyone is talking about biostimulators, bioregenerators. Well, CO2 lift is needed. And then, you think about, people are, a lot of the HA fillers are going away. People, they want more natural things, right? We're right in the mix of that. So I just, I appreciate you having me. I didn't even realize that this was.
Yeah, this is a podcast. Yeah.
I think I hope I didn't say anything that shouldn't have been said, Lauren.
No, this is it. This is it. You were great, very natural. And it's about interviewing, key people, influential people. I'm not doing most of the talking, it's all the guests. Yeah. Yeah.
Well, I appreciate you having me on. And then again, for the women that are listening to your podcast, certainly, we think about skincare as just the face and the neck. We jump down to the knees. We forget the most important skin, which are intimate skin. And that's about quality of life. So I think I would love for more and more women to think of that area and as a part of their wellness program, not to wait until they're in their 50s and 60s when now you're experiencing dryness. Now you're really experiencing the effects of aging down there. Start from like we're talking about baby Botox or baby talks. Start from in your 20s to start thinking about that area of your body and keep it youthful and fresh so you can keep your intimate life healthy and you feel powerful all the time.
Excellent. Well, thank you, Ms. Kerr. And I look forward to, I sent you my address, and we should definitely keep in touch since we are in the same space. And thank you for all your insights today, and have a happy holiday and weekend. Thanks for spending a Saturday morning with me.
Thank you for having me. And I will definitely send you both the top and the bottom for you to try.
Awesome. Yay. Thank you so much. Have a great Saturday.
All right. Take care.
Thanks.
Bye-bye.